Today, we're talking about something that could save lives: the early warning signs of blood cancer. Now, I know cancer is a scary word, but what's even scarier? Not knowing the signs until it's too late. Blood cancer is a silent killer, affecting thousands worldwide every year. The worst part? Most people don't realize they have it because the symptoms can be so subtle, things like fatigue, unexplained bruising, or night sweats. Easy to brush off, right? But ignoring these signs could be a life-threatening mistake. The good news is that early detection saves lives. The sooner you spot these symptoms, the better your chances of effective treatment and survival. So today, we're breaking it all down, the most critical, overlooked warning signs you need to know. Let's get started with the first symptom you should never ignore. Number 1, swollen, painless lymph nodes. Swollen, painless lymph nodes can be one of the earliest warning signs of blood cancer, yet many people ignore them because they don't cause discomfort. Lymph nodes are an essential part of your immune system, acting like filters that help fight infections. Normally, they swell when you're battling a cold or infection, but in cancers like leukemia and lymphoma, something far more serious is happening. Instead of fighting off germs, the lymph nodes become enlarged because abnormal white blood cells are accumulating inside them, disrupting their normal function. The key sign to watch for is persistent swelling in areas like the neck, armpits, or groin that doesn't go away after a few weeks. Unlike swollen lymph nodes from an infection, these are often painless and don't shrink over time. According to a 2018 study published in the Journal of Clinical and Experimental Hematopathology, lymph nodes that remain swollen for more than 2 weeks without signs of infection should be medically evaluated. If you notice this symptom, don't wait. Schedule a checkup with your doctor immediately. While swollen lymph nodes don't always mean cancer, early detection is key, and getting them checked could make all the difference in catching blood cancer in its earliest stages. Number 2, shortness of breath. Shortness of breath is often associated with conditions like asthma or heart problems, but did you know it can also be an early warning sign of blood cancer? Blood cancers, such as leukemia, lymphoma, and multiple myeloma, interfere with the body's ability to produce healthy red blood cells. This disruption can lead to anemia, a condition where there aren't enough red blood cells to carry oxygen throughout the body. As a result, you may start feeling constantly out of breath, even when doing simple tasks like climbing stairs or walking short distances. In some cases, an enlarged spleen, a common effect of blood cancer, can press against the lungs, making breathing even more difficult. Some blood cancers can also cause cancerous cells to infiltrate lung tissue, leading to persistent breathlessness and a tight, constricted feeling in the chest. According to a 2023 study published in BMC Cancer, about 44% of blood cancer patients reported experiencing respiratory symptoms, including shortness of breath, at the time of their diagnosis. If you find yourself frequently gasping for air, don't ignore it. A simple blood test and imaging scan can help determine if an underlying issue, such as blood cancer, is affecting your oxygen levels. Early detection can save lives. Number 3, persistent weakness and fatigue. Persistent weakness and fatigue might seem like a normal part of life, but when it becomes constant and overwhelming, it could be a sign of something far more serious: blood cancer. Unlike regular tiredness that improves with rest, this kind of fatigue is deep, unrelenting, and doesn't go away even after a full night's sleep. Blood cancers interfere with the body's ability to produce healthy red blood cells, which are responsible for carrying oxygen to tissues and organs. With fewer red blood cells, the body struggles to distribute oxygen efficiently, leading to severe exhaustion and a constant feeling of weakness. Everyday tasks, like walking up the stairs or even getting out of bed, can start to feel like a challenge. According to a 2023 study published in Scientific Reports, 40% of blood cancer patients reported experiencing unexplained, severe fatigue before their diagnosis. This isn't just feeling a little tired, it's a level of exhaustion that disrupts daily life and doesn't improve with rest. If you've been experiencing persistent weakness or fatigue for weeks, don't brush it off. A simple blood test to check hemoglobin levels can help determine if anemia, or something more serious, is the cause. Don't ignore what your body is telling you. Number 4. Night sweats. Waking up drenched in sweat, even when your room is cool, could be more than just an uncomfortable night. It might be an early warning sign of blood cancer. While occasional night sweats can happen due to stress, menopause, or infections, persistent and severe night sweats without a clear cause can indicate something more serious. Blood cancers like leukemia and lymphoma can disrupt the body's ability to regulate temperature, leading to excessive sweating, particularly at night. Cancer cells interfere with normal immune system function, triggering inflammatory responses that can overheat the body. Unlike regular sweating, these night sweats are often severe, soaking through clothes and sheets, and can happen without fever, exercise, or warm room temperatures. A 2023 study published in the European Journal of Hematology found a strong link between lymphoma, leukemia, and frequent night sweats, making this a symptom worth paying attention to. If you're waking up drenched night after night without an obvious cause, it's time to seek medical attention. While not every case of night sweats means cancer, when paired with other symptoms like fatigue, weight loss, or swollen lymph nodes, it's a red flag that should not be ignored. Number 5. Loss of appetite and nausea. Loss of appetite and persistent nausea may not seem alarming at first, but when they occur without an obvious reason, they could be early warning signs of blood cancer. Blood cancers like leukemia, lymphoma, and multiple myeloma can alter the body's metabolism and how it processes nutrients. As a result, people may experience a sudden drop in appetite, feel full quickly after eating just a small amount, or develop unexplained nausea. This happens because cancer cells disrupt normal digestion and metabolism, making it harder for the body to properly absorb and use nutrients. Additionally, an enlarged spleen or liver, which often occurs in blood cancer patients, can press against the stomach, creating a feeling of fullness even when you haven't eaten much. A 2019 study published in Intestinal Research found a significant link between blood cancer, metabolic dysfunction, and appetite loss, further highlighting the importance of this symptom. Unexplained weight loss, especially when combined with other symptoms like fatigue or night sweats, should be taken seriously. If you've lost your appetite for weeks, are feeling nauseous without a clear reason, or are losing weight unintentionally, it's time to see a doctor and get the necessary medical tests. Early detection saves lives. Number 6. Itchy skin. Itchy skin is something most people associate with dry weather, allergies, or insect bites, but persistent, unexplained itching could actually be an early sign of blood cancer. Blood cancers like leukemia and lymphoma can trigger an abnormal immune response, causing cancer cells to release inflammatory chemicals into the bloodstream. These chemicals, including cytokines, can irritate the nerves in the skin, leading to severe, persistent itching that doesn't go away with regular moisturizers or antihistamines. What makes this kind of itch different? It's intense, constant, and doesn't seem to have a clear cause. Many people with blood cancer report feeling deep, burning itchiness, often worse at night or after a warm shower. Itching that occurs alongside other symptoms like fatigue, night sweats, or weight loss is particularly concerning. A 2019 study published in Dermatologic Therapy found that 30% of patients with Hodgkin's lymphoma experienced severe itching before diagnosis. If your skin irritation has been ongoing for weeks without relief, it's crucial to see a dermatologist and request a blood test. While itching alone doesn't mean cancer, when combined with other warning signs, it could be a red flag that needs urgent medical attention. Number 7. Unexplained bruising and bleeding. Unexplained bruising and bleeding may seem harmless at first, but when it happens frequently without an obvious cause, it could be a warning sign of blood cancer. Blood cancers like leukemia, lymphoma, and multiple myeloma can affect the bone marrow's ability to produce platelets, the blood cells responsible for clotting. With low platelet counts, a condition called thrombocytopenia, even minor bumps can lead to large bruises, and small cuts or scrapes may bleed longer than usual. One of the most common red flags is bruising that appears suddenly, in unusual places, like the arms, legs, or back, without injury. Some people also experience frequent nosebleeds, gum bleeding after brushing their teeth, or tiny red or purple dots, petechiae, on the skin, which indicate small blood vessel leaks. A 2023 study published in BMC Cancer found a strong correlation between leukemia and unusual bruising or bleeding, making this an essential symptom to recognize. If you notice frequent or unexplained bruising, prolonged bleeding, or unusual skin spots, don't ignore it. Ask your doctor for a CBC, complete blood count, test, which can detect abnormal blood cell levels. Early detection is key to diagnosing and treating blood cancers effectively. Number 8. Fever or chills. Frequent fever or chills might seem like just another sign of a cold or flu, but when they happen persistently and without an obvious cause, they could be early warning signs of blood cancer. Blood cancers like leukemia and lymphoma weaken the immune system by interfering with the production of healthy white blood cells, which are essential for fighting infections. As a result, the body becomes more vulnerable to infections, often causing unexplained, recurring low-grade fevers. Unlike fevers caused by common infections, these fevers are often persistent, mild, usually below 101 degrees Fahrenheit or 38.3 degrees Celsius, and occur without any other flu-like symptoms. Many patients also experience chills and excessive sweating, even without an active infection. This happens because cancerous cells trigger an inflammatory response in the body, which disrupts normal temperature regulation. If you've been experiencing frequent, unexplained fevers or chills for weeks, it's time to pay attention and consult a doctor. While fever can have many causes, when it occurs alongside fatigue, night sweats, or unexplained bruising, it could be a red flag for an underlying blood disorder. A CBC, complete blood count, test can help detect abnormalities in blood cells and guide further investigation. Don't ignore persistent fevers, early detection could save your life. Number 9. Frequent infections. Getting sick every now and then is normal, but if you find yourself constantly battling infections, it could be a sign that something deeper is going on, possibly blood cancer. Your immune system relies on healthy white blood cells to fight off bacteria, viruses, and other harmful invaders. However, blood cancers like leukemia, lymphoma, and multiple myeloma disrupt this process by reducing the number of normal white blood cells, leaving your body vulnerable to frequent and prolonged infections. One of the key signs to watch for is getting sick more often than usual with colds, sinus infections, urinary tract infections, UTIs, or even pneumonia. You may notice that infections last longer than they should or don't respond well to standard treatments. Some people also experience slow wound healing, frequent sore throats, or recurring skin infections. If you find yourself getting sick back to back, struggling with infections that won't go away, or constantly feeling like you're fighting something off, it's time to consult a doctor. A complete blood count, CBC, test can help determine if your white blood cell levels are abnormal. Don't ignore what your immune system is telling you, early detection is critical. Number 10. Coughing and chest pain. A persistent cough or unexplained chest pain might not seem like symptoms of blood cancer, but they can be. Blood cancers like lymphoma and leukemia often cause enlarged lymph nodes, which can press against the lungs or airways, leading to chronic coughing and discomfort in the chest. Unlike a cough from a cold or flu, this type of cough doesn't come with congestion, phlegm, or fever. It lingers for weeks without an obvious cause. Some patients also experience chest pain or tightness, which isn't linked to heart disease, but instead caused by pressure from swollen lymph nodes near the lungs. In some cases, cancer cells infiltrate lung tissue, making breathing more difficult and causing a feeling of heaviness in the chest. If you've had a persistent dry cough that won't go away or chest pain that doesn't seem related to heartburn or muscle strain, it's time to get checked by a doctor. A chest X-ray, CT scan, or blood tests can help determine if an underlying issue, such as blood cancer, is the cause. Don't dismiss ongoing respiratory symptoms. Early detection is key. Blood cancer can be silent but deadly, and its symptoms are often subtle, making them easy to overlook. However, early detection is key to survival. Recognizing persistent signs like unexplained fatigue, swollen lymph nodes, frequent infections, night sweats, or unusual bruising could mean the difference between catching it early and facing a late-stage diagnosis. If you're experiencing multiple symptoms, don't wait, consult a doctor immediately. A simple blood test or imaging scan could provide crucial answers. Your health is too important to ignore. If this video helped you, hit the subscribe button, share it with your loved ones, and help spread awareness. The more people know, the more lives we can save together. Stay informed, stay proactive, and take care of yourself.